Various organizations, departments within the national government, and the health sector within Thika West Sub-County have kicked off the 16 days of activism against gender-based violence campaign with a plea to residents to eliminate all forms of violence against women, children, and also men. According to Dr. Peter Mucunu, at least 15 cases of SGBV are reported monthly at Kiandutu Health Centre, with majority of these cases going unreported due to fear, stigma, and lack of proper information. He attributed gender-based violence to drug abuse, financial instability, among other circumstances affecting the society.
My name is Peter Mucunu. I'm studying for the Thika Sub-County Sexual and Gender-Based Violence Coordinator. By definition, sexual and gender-based violence is any violence committed to a person because of his gender or her gender or maybe her sex. We should experience these cases averagely per day. And that is the facility that I work in, Kiandutu Health Centre. And averagely what I was saying, in a month you can be able to handle minimum, if it goes by the lowest number, 15. But the problem with our community members is that they usually don't like to report because they feel, okay, some even don't know where to report to. So those cases are so many. And I believe they had been attributed because of the drug use, which is very vibrant in our areas, and also unemployment. People are idle, they take drugs, they just think so many things, and they happen and end up doing so much crimes.
Dr. Susan Gitau appealed to the relevant government agencies to facilitate free psychological and medical support to the victims as a way to help them overcome the trauma. She noted that this form of violence was not limited to only women, as men also fell victims to physical and emotional violence, as well as sodomy among the young boys.
My name is Dr. Susan Gitau. I'm a counseling psychologist. Kenya Counseling and Psychological Association Chairperson, Kiambu County, and also a trustee of Susan Gitau Counseling Foundation. That we are going to offer free counseling services, legal services, and even medical services where possible tomorrow, on Monday and Tuesday. And then we are going to have a climax on 4th, where we are going to all converge at Kimushu Secondary School in Kiganjo, that is in Thika West. We don't just want to talk about girls and women, even if that is the gender that is highly violated, we are also including the boy child and the men, because we are having more and more men coming out. They are talking, and we have seen, especially for men, it's more of emotional and psychological abuse. For the boy child, sodomy, like you have heard from the medical perspective and reports, is also rising. And we can tell that if this situation goes on, what we are going to have from a psychological perspective are very many severely traumatized community. In a traumatized community, one of the outcomes or behavior that is negative is anger. And when you have anger issues, you're easily irritable, you cause more violence. So the cycle continues. We are going to have legal officers, magistrates joining us, especially the children magistrate from Thika, and they are going to tell us, if there's also going to be an open mic forum, they are going to tell us how many of those cases usually are closed. Because for now, for me to say they get justice, that should come from the judiciary.
Among the participants included the Thika West Deputy County Commissioner Office, area chiefs and their assistants, the Kiambu County Government, the National Gender and Equality Commission, Thika District Business Association, Action for Children in Conflict, Dr. Susan Gitau, Counseling Foundation, and Girl Child Network. The official launch shall be held on 4th December at Kimuchu Primary School grounds, where various players and stakeholders will be invited to sensitize the members of public.